This week, Dr. Dotson was on, and I guess it's a two-part series of medication, ADHD medication. And this time we talked about the methodology of medication titration. And what do I mean by that? Well, it's not like you got a cold or a flu and here's a antibiotic to take. You're a certain age, you're a certain weight, therefore you need this much, and there off you go. ADHD medication requires to be titrated, meaning everyone's ADHD is different, everyone's body is different, and there's a proper methodology to finding the right titration for you. And titration, just to clarify for people, means the amount or dosage of medication that will work for you. Just because I'm a 50-year-old male, I wish I was 130 pounds, but 230 pounds doesn't mean I have so many milligrams of said medication. We have to start from the process. So when I first got diagnosed and was put on medication, I was put on a low dosage. I was on that for a week. What were the effects? What did it happen? What happened and what didn't happen? Nothing much changed. Increased the dosage little by little. So this was actually a 6-month process to find a dosage that was apparently starting to work for me. And that's what we did with my kids, and this is what I'm seeing with a lot of other people. So that's the titration process. But there's a proper methodology that Dr. Dotson has developed over the years, and he really wants to get this information out to the doctors, the practitioners, but I wanted this information out for you so you can bring that information to your practitioner, because not everyone's highly experienced with adult ADHD, and any information that can help you too, like it's a partnership. That practitioner is helping you get better and you provide the information so they can do that. It's a partnership, okay? And the key thing that makes this titration challenging is that for especially stimulant medications, even the non-stimulant subs one, we still have to titrate. But all medications work differently for every person, for every brain type, for every, and knowing that it's different for every different person is very key to understand. That's why we need this titration process. And he also noted that 70 to 85% of people, 70 to 85% of the people only experience a robust response of stimulant medications, while some people, the 25 to 20% or 25 to 30% of people don't feel any robust responses, and I'm one of them. So I'm one of the 20% that doesn't have robust responses from stimulant or anti-stimulant medications. And that's just a statistics, and we got to be aware of. So the medication myth he really discussed, and then we need to make this clear. Why pills don't fix ADHD. They don't fix ADHD. They help you level the neurological playing field. I don't believe ADHD needs to be fixed. I don't want my ADHD brain to be fixed. It works well. Now that I understand it and I'm able to manage and harness it effectively, it doesn't need to be fixed. But taking the stimulant medication levels out the neurological playing field, especially for kids, or if you're in university, college, or working in a company that's very, you need to be focusing a little more effectively and follow structure, or organizations. That's what the ADHD does. It levels the neurological playing field. It doesn't fix nothing, okay? We still have to come up with different strategies to be able to work well, but that's just because our brains are wired differently, and our brains are not wired for today's world, the farming world. Remember, we're hunters, okay? So there's still a need for personal effort and strategy with the use of medication. And his main point, and I really like how he explained this, that medication is a tool and it's not a complete solution. A lot of people think it's a magical pill that's going to fix everything and make me a lot better, but it's not. It's a tool. It's part of your treatment, medication, education, and therapy or self-work, okay? Education, therapy, and medication, okay? So it's a tool. It's not a fix for all. And then this is how he called it. I like this. Was the titration treasure map. And that's the process he's discussing. Okay, so if you got a bone leg, if you've got a certain disease, we got a list of medications that will work for that specific ailment, depending on the dosage, depending on your age, your weight, dosage is pretty much a calculation, and off you go, have a nice day. But the goal for the titration treasure map is to find the right medication, molecule, and dosage for each individual. For me, I was put on the Concerta first. Then I went to, I can't forget. It's been a while. So I started on Concerta. Vyvanse. I was started on Vyvanse, went to Concerta. Then I went to atomoxetine. And we kept moving the different types because the first, I think it was the Vyvanse. It wasn't doing much for me, so we went to Concerta. It would start to have an effect. So that's finding the right medication, which is the right molecule. So those are all different molecules, the different types of medication. And then when we started all at a low dosage, try it for a week or two, see if there any changes. If there weren't, increase the dosage a little higher for the next time, 2-3 week cycle. Okay, and that's the titration part, increasing the doses until you have some effect. And the thing is, he really made a good point, is before we actually start this treasure map, is we have to identify, you and your practitioner, what specific symptoms you're going to target. Not just have this miracle pill fixing everything, because that's not true. So you and your practitioner will decide which symptoms you want to target, and that's what the medication, so you can measure against that now, not just a hope to hell that it works for everything. So with that targeting the symptom, that's how the titration part will help and work. That's how the dosage. So if you increase the dosage, let's say I want to get, I don't want to keep forgetting my books or something, or I got to keep forgetting my homework, okay? Well, that requires a certain focus aspect. So this 2 weeks from now with this dosage, are you forgetting your homework still? Yes, I am. Let's increase a little more. Well, now it's not so much. Well, let's open it up a little more. Well, no, I'm actually hardly forgetting them. Let's dose it up one more time. Oh, wait a minute, I'm starting to lose stuff again. I'm forgetting stuff again. Well, then we'll bring it down. That's the titration part. And it takes time and patience. By understanding what symptoms you want to target, you can measure and compare the results effectively. And like I said, we are starting with the lowest possible dose to start and increasing to get to just beyond of what's working to bring it back. And that's what he said, and makes sense. So it's a process you need to have faith in and believe in. And this would really hit me. Why can't we just, based on your age, your weight, and history, why can't you just have a certain medication with a certain dosage? Well, he said any other medication gets dissolved in the body or in the stomach and into your blood. But the stimulant medication is actually working in the brain part. It's the barrier, it's what he called the blood-brain barrier. So that's what determines the dosage. What dosage is required to go from the blood to the brain, that barrier, not stomach to the blood. And that's why there's a difference in dosage and effects. It's because that blood-brain barrier, and that's, you can't measure. And that's why we need to do the titration method. And just like I already repeated, this is beyond standard treatment. This is a special way of doing it that requires patience and communication, right? One size doesn't fit all. It doesn't work for everyone. There are alternative medication approaches, and like I said before, it's very important that you have a personalized medical partnership between you and your practitioner, that you're both listening to each other, you're providing honest information, and they're doing it. But you both have to be involved. It's going to take time to find the right titration, the right dosage, and the right medication. I went through 3 different types. And it takes time. It took up to 6 months to finally find a medication when I first got diagnosed in my Life Tempest to start having some effect that I can reorganize and reshuffle and get control of my life back, because it was not a pleasant time. So it takes time and patience, but just have faith that you're going to do it. Target the symptom that you want to affect. Start with the lowest dosage. Compare after a few weeks. Increase the dosage. If it's not doing anything, you might find a different molecule or a different drug, okay? But the key thing here is make sure that you are having informed conversations with your practitioner, and you're not relying on TikTok and social media to make these decisions for you. Trust your practitioner. They know what they're talking about. They should be open to alternative ideas and information you're presenting, but you need to have the conversation. It's a two-way street. It's a partnership. So just keep thinking that. Any medical issue that you have is a partnership between you and your doctor. So please, let me know what you think of this episode. You can send me an email at andre@theimpulsivethinker.com. I would love to hear from you. And have a listen of this. Take this information to your practitioner and take it. Recommend this podcast to them just to see with the process that it takes time, but it's doable and can be done. So thanks again for listening and learning with me. We'll talk to you soon. Take care.